Hello everyone, I'm Karen C. Corpuz, one of the Batch 8 trainee in NCMA Nurse Caregiver Management Alliance here in Malaysia. This video will demonstrate the proper way of transferring patient from bed to wheelchair and vice versa. Sit up the patient. Lock the wheelchair, help the patient turn over onto his or her side facing you. Put an arm under the patient's upper back with your hand, supporting the shoulder. Put your other hand behind the knees. Swing legs over the edge of the bed, helping the patient to sit up. Stand the patient up. Have the patient scoot to the edge of the bed. Put your arms around the patient's chest and clasp your hand behind his or her back. Support the leg farthest from the wheelchair between your legs. Lean back, shift your weight, and lift. Sit the patient down. Have the patient pivot toward the chair as you continue to hold on. Always transfer toward the person's strongest side. As the patient bends forward, you bend your knees and lower the patient into the back of the chair. First, sanitize the bed. Lock the brakes of the wheelchair and move the wheelchair close to the bed. Put your arms around the patient's chest and clasp your hand behind his or her back. Ask the patient to push up on the handles of the wheelchair for support as you pull them up. As you pull them up and put them on the bed, stand and pivot only, no steps. Remove shoes, put hand on the base of the neck and the other hand behind the knees to support them laying on bed. Cover up with blanket and perform the proper hand hygiene. Take care of your back. Lifting a patient can be hard on your back. To reduce the risk of injury, remember to do the following. Organize the steps in your head before you move. Explain the steps, move, and ask the patient when he or she is ready to move. Keep your knees bent and your back straight. You may use a transfer belt to provide a firm hold rather than clasping your hands behind his or her back. Get help when you need it. As practice with supervision.
Good day everyone. This time, I'm going to present the most common techniques on how to transfer your patient from their bed going through the wheelchair. This person might experience stroke or having a dysfunction of bodily movements.
Moderate assistant transfer. Position the chair in the line of the bed. Make sure that there is enough space at the edge of the bed before rolling the patient over. First, ask the patient to hold onto the weaker arm. Next, bend the opposite knee with one hand on the pelvis and the other hand on the patient's shoulder part. Ask the patient to roll towards you with your guiding as necessary. Next, ask the patient to use her stronger leg to bring the weaker leg over the edge of the bed. Stabilize the patient's hip and ask the patient to push up to sitting. If the patient is sitting too far in the bed, shuffle the patient's bottom forward. First, lean the patient on the right and guide the left buttock forward. Lean the patient the left and guide the right buttock forward. Ensure that the both of the patient feet are placed flat on the floor. Place the chair near the patient's strong arm. Ensure that the bricks are applied. Stabilize the patient's knees between yours. Lower yourself to the patient eye level and bending your knees but keeping your back straight. Communicate to the patient what she is about to do. Patient can place her stronger hand on the armrest wheelchair. Ask her to participate by leaning forward and turning towards to the bed to bring the buttock across to the wheelchair. Sit and make sure that your path of view is not blocked on the patient head. Cue the patient timing by saying 1, 2, 3, up. To transfer, lean the patient forward, pivot the patient, Knees bring the buttock over the chair. Assist the patient to sit well back in the chair. Make sure that the patient is sitting up straight at the center of the chair. Make sure that the foot plate are secured before pushing the wheelchair. Now, assuming that everything is done when she's sitting on her wheelchair. Now, it's time to transfer her from her wheelchair to bed.
Hi, welcome to my presentation today. I will be show you how to perform a bed to wheelchair transfer.